Hi, I'm Megan Hughes. Welcome to the Stillwater Counseling and Pain Management series on central sensitization. I hope to be able to give you the benefit of the research that I've done in this area and all the years that I've worked with people who have struggled with various kinds of sensitization syndromes. Many of my clients are in recovery or have completely recovered, and I hope that this information will help you to do the same. One of the most common questions I get in my practice with clients with chronic conditions is about central sensitization. The question is, what causes it? I think people ask this because the medical system isn't clear on it. It's a diagnosis that's given more on the basis that it can't be anything else. So people go through a lot of testing for various conditions like MS, arthritis, neurological conditions, hormonal conditions. But if they don't have a clear explanation for what's going on, sensitization is a default diagnosis. And if a person has a whole list of diagnoses that are autoimmune or inflammatory by nature, then that's also considered sensitization. The reason this condition is hard to diagnose is because there isn't one known cause. Like with diabetes, it's resistance to insulin, and that can be measured and charted. But with sensitization, there are many factors, and time is one of them. So let's consider this cause. If you think about what sensitization is exactly, it's a slow increase in sensitivity to certain areas of the body or to the whole system over time. Although it can be hastened and exacerbated by unfortunate events in life, the causes go back all the way to the beginning. So we start on this journey with a person who, in their childhood, seems to have a fairly normally functioning body. They eat what they like, they move how they like, they don't experience any particular discomfort on a daily basis. Most children, in fact, are fairly unaware of their bodies. It's rare to find children who have pain conditions or sensitization conditions. Some do, but it's rare. So let's say you're born with a fairly normally functioning body, but each body functions normally differently. What's normal for you may be very different and not normal for someone else. So what we need to look at is what is the physical foundation that this person is starting off with. By far, the majority of people that I've worked with sensitization are sensitive people by temperament. In fact, I would venture to say all the people that I work with chronic conditions are sensitive people. That means sensitive by nature. So what that looks like is if you identify yourself as a sensitive person, or if you know that you are empathetic, if you have had food sensitivities in your life, if you were called shy or socially anxious, these are signs of temperamentally inborn sensitivity. I always say that sensitive people are a gift, and that being sensitive is a wonderful thing. The world needs more sensitive people. Insensitive people who are running the world ragged because they're not thinking about the consequences on people and what people need and how they feel. So, whereas it's a gift to be a sensitive person, it can also be a burden. Many, many times over the years, I've worked with sensitive, empathetic people who feel bombarded, overwhelmed, lost in a sea of feelings, having to live outside of themselves or to defend themselves from the world. Sensitive people need to have emotional boundaries. They need to have guidance about how to find where the line is between sensitive for others and sensitive for self. But that's another topic. You know what the world is like, just a normal world. But imagine what the normal world is like for a sensitive child from the child's point of view. It's challenging in most respects. And then you add to this sensitive child some kind of stressors in the household growing up, perhaps conflict or neglect or perhaps abuse. There are a whole range of misfortunes that can fall on children in their homes. So you add to a sensitive nervous system the need to cope or deal with something difficult in the home for years on end. That's a layer. So we've got a sensitivity as the first layer of activation of the nervous system. Then we've got dealing with difficulties at home as the second layer. Now we add things like family coping styles. If the family yells and shouts at each other as a way of coping, that's another layer. If the family pretend nothing's wrong and gaslight the children and say, nothing's going on here, it's all in your head, that's another layer. So we can imagine coping styles add to the sensitive nervous system increased activation and increased anxiety and increased hopelessness. I mean, why bother? Trust is affected, a sense of reality is affected, and hope for the future is affected. Unless a person learns positive coping strategies, it further blocks any kind of movement toward resolution. So this keeps sensitive people feeling stuck and sort of steeped in the dysfunction. And for a sensitive nervous system, that's toxic. You can imagine a sensitive child dealing with dysfunction and looking for guidance about how to get through the dysfunction, then finding the coping strategy of, say, worry. Maybe that's the family style. Worry says, if I control everything, then maybe everything will be okay. I can't trust anyone to do it right. I have to do it myself. If I'm vigilant, then maybe everything will be okay. Imagine the nervous system now. So we're still in childhood, and so the nervous system is weathering all of this and is continuing to function. We add on to this any kind of socioeconomic hardships. If a child is suffering from impoverishment, emotionally, mentally, physically, that causes another level of stress. And then, of course, societal stresses such as systemic racism or bullying or the failure of the institutions we rely on. So now we imagine that this child is enduring all of this and functioning and carrying on in life and making the best that they can of it because they don't know any different for years and years. And now we come to the teenage years. Perhaps teens, early 20s. Then the nervous system has now adapted to this default state of high activation. And now it's trying to just get through life and having more serious life experiences. Maybe there are relationship losses. Maybe friendships have some difficulties as they do. There are school experiences where there's expectations and pressure and stress. There's judgment and criticism and comparison to others. It seems overwhelming even now to think about it, but we're not even at the finish line yet. We have a nervous system now that's primed for difficulty, but at this point, it's not tipped over into dysregulation yet, because perhaps the person is still finding resilience in their hopes and their beliefs. Maybe they say, when I'm old enough to get out of the house, and then I'm going to have my freedom, and that's going to help. So they're just looking forward, and they're focusing on their goals. I'm going to go to university. I'm going to get my own job. I'm going to make my own money. I don't have to live here anymore. I don't have to rely on these people. I'm going to be free. I'm going to have my own life. So there's things to look forward to that prop up the nervous system and keep the energy flowing. There's some relief there. So let's see. This nervous system is primed. So at this point, people sometimes tend, and a lot of times they tend, to start to have mild symptoms in the teenage years and the early 20s. They might have insomnia or anxiety or headaches, things that could be considered normal, just normal because of stress. So this person carries on in their life and they do the best they can. Then they get a partner, they settle down, they start to work, they have a career, they have children, they move forward. They do some adulting. Usually it's with the same old coping strategies though. So they're adding layers of activation to their nervous system. So the demographic that I see the most often tend to be women, although I do see men with these conditions. By far, statistically, there are more women with these conditions. So I see women in their sort of mid-20s to 50s who are intelligent, educated, articulate, and capable. They are doers. I'm just going to get it done. It's easier for me to do it, so I'll just do it myself. They push through as a coping strategy. And this pushing through gets them quite far because they enjoy feeling capable and efficient, and maybe even more than most people. But at some point, it loses its effectiveness. For example, a person who's working full time and has their own kids to take care of, and they have their own parents to take care of, they're still volunteering at their kids' school. They're still doing favors for friends. They're still saying yes when they're asked to pitch in and help someone else. They say, I'll just do it because it's easier for me to do it than it is to ask somebody else to do it. I've heard that many, many times. So you can feel the level of activation and the level of stress that this person lives with and just feels as though it's normal. And in fact, feels good about themselves the more they can do. And further to that, when they contemplate self-care, they start to feel guilty. Oh no, I couldn't put myself first. There are many other people who have needs, and I'm okay. I can do more. It's okay. I'm fine. So here we have a nervous system that's just ready to tip over, and then life happens. There's a car accident. There's a stress like a job loss. There's a grief in the family, or a major conflict, or they get sick. A lot of people ended up tipping over into dysfunction with COVID. This kind of dysregulated autoimmune reaction that you see with long COVID has been happening years before COVID, but now that it's been so clearly seen by the medical system, it's getting research, which is a good thing. So now, this nervous system cannot hold any more stress and tension. It cannot cope with any more. It is full, and this person has been living with this amount of stress for years, and they're a sensitive person. They have coping strategies that do not fully deal with the stress. They're anxious, maybe they're negative, or they push through. They struggle with self-care. They struggle with boundaries. They have unresolved traumas from perhaps unresolved childhood stresses. And then they have all the normal stresses of being an adult in the world. So you can see when I listed out how it's amazing, layer after layer, that more nervous systems don't tip over into dysfunction. What happens is the brain sensitizes the areas of the body that require attention. For example, if you break your arm, you'll have pain. You'll have mechanical pain from the bone rubbing on the nerves and the tissues. You'll also have sensitization pain. So that's the swelling and the inflammation. With the increase in blood flow, you feel achiness, you'll feel pressure, and the brain sends more sensitization chemicals because it's a painful area. It increases synaptic flow to that area to amplify the pain signal, to get the willful mind to pay attention, to be careful, to change behavior about that area. It's a very smart system, and it's allowed us to survive and become top of the food chain for centuries and millennia. So we don't want to do away with that process. We just need to understand it and manage it. So the origins of sensitization are then first level, temperament, second level, background, third level, stresses and time, fourth level, tipping point. Then understanding sensitization as the brain thinks it's doing the right thing for you. It's been listening to the alarm signals in your body probably for years, subtle alarm signals that people push through and try to ignore. There's a school of thought out there that says if you pay attention to pain, it will get worse. So it's best to ignore it. But let's clarify that. We don't want to give life over to pain, right? We don't want to amplify it, but we also don't want to ignore it because the brain is communicating for a reason. Your body is telling you something, and you need to listen. We must pay attention to the pain so that we can then figure out what's happening here, what do I need, and then guide the body to calm down. Just like when we want to get stronger, we guide the body to working out and lifting weights. And it improves our muscle tone, it improves our fitness. We have to guide the body to achieving the goals that we consciously and willfully want. If you want to eliminate or decrease sensitization, you need to start training the brain, which is part of the body, to view the signals differently. So now we're getting into what to do, and that's the next podcast, because there's a lot you can do. Right now, you can see that the overall cause of sensitization is not one thing. It's a holistic picture of health, coping, stress, functioning, temperament, and exposure. Now, with all that, try going forward and start connecting with your body's signals and your brain a little bit differently. Listen and ask, what is it trying to tell me? How do I really feel? You might be surprised.